2-20, the adsorption procedure. Antibody can be removed from a serum sample by adsorption onto red cells that express the corresponding antigen. After the antibody attaches to the membrane-bound antigens, the antibody remains attached to the red cell when serum plasma and cells are separated. It may be possible to harvest the bound antibody by elution or examine the adsorbed serum or plasma for antibodies remaining after the adsorption process. The principle states antibodies can be removed from a serum sample by adsorption. It may be possible to harvest bound antibody by elution or examination of the observed serum for antibody or antibodies remaining after the adsorption process. The adsorption procedure is quite simple. The theory behind the adsorption procedure is more complex. This week we'll cover the adsorption procedure itself, and next week we'll apply it to actual antibodies. This specimen you'll need is serum or plasma containing an antibody that you'd like to adsorb, and the red cells should express antigen corresponding to the antibody. You may have autologous red cells, meaning from the patient, or allogeneic, meaning from other donors or reagents. To begin our discussion about the adsorption procedure, I'll show you a short video of an allogeneic adsorption. In an allogeneic adsorption, we take typically 3 cell lines for a screening measure. Each of the cells represents a different donor, and each donor has a different phenotype. We can use their phenotypes to absorb out antibodies, and plasma will remain so that we can test the plasma for antibodies while others are adsorbed onto the red cells. The first step in the procedure, which I do not have a video of, is washing the reagent red cells 3 times and then a 4th time for at least 5 minutes, a hard spin. This is to remove any residual saline and to really pack the red cells down. We don't want to dilute the adsorbed plasma serum, as you'll see in this demonstration. Once your red cells are ready to adsorb, we will take the patient plasma and we'll add it approximately 20 drops, or equal to the volume of red cells. So in this image, you see the donor reagent red blood cells at the bottom, and you see the patient plasma at the top. The patient plasma theoretically contains an antibody, let's say a warm autoantibody. The reagent donor red cells will theoretically remove the warm autoantibody when the antibodies attach to the red cells. We will then have a plasma with the warm autoantibody removed. I'll take these 3 cell lines and I'll mix them. Then I will take them either to the fridge, as shown in this video, or I can also take them to an incubator. Typically, I incubate for 30 minutes to 1 hour. Once the adsorbed plasma and donor reagent red cell mixture has incubated either at room temperature 37 or refrigerated temperatures depending on the alloantibody or autoantibody specificity. I'll spin the cell and plasma mixture, and you'll see a delineated line of adsorbed serum plasma and donor reagent red blood cell. In our example of warm autoantibody, the warm autoantibody should now be coating the reagent donor red cells, and the adsorbed plasma at the top will contain underlying alloantibodies if they exist. If the patient has no underlying alloantibodies, we'll see no reactivity in the adsorbed plasma because the warm autoantibody is now adsorbed onto the red cells. Sometimes, depending on the strength of the antibody, for example, some warm autoantibodies react with 4+ strength, we may need to do additional adsorptions, more than one round of adsorptions. So in this video, I'm demonstrating taking the R2 times 1 adsorbed plasma and adding it to a second time to incubate with even more donor reagent red blood cell exposure to remove that very strong autoantibody. So I'll just simply remove the adsorbed plasma from the times 1 procedure, and then I'll add it to my second tube to begin my times 2, and I'll mix. This next video represents my completed adsorption. So after this adsorption times 2, I now have alloadsorbed plasma, and I'm ready to test it. If you notice, the adsorbed plasma can become a bit hemolyzed. Typically, it's because the reagent donor red cells are old. We'll talk about this more later on, but in more high complexity level testing, we can take the donor reagent red cells which have an antibody on them and perform an elution procedure to remove the antibody and then test that antibody specificity. Also, at the end of this video, you'll see our adsorbed plasma by itself, which is ready for testing. As you can see, we have a very limited sample, so it's important to be conservative. Finally, back to the method, the interpretation states, if reactivity remains, the antibody has not been completely removed. No reactivity signifies that antibody has been completely adsorbed. Adsorption is more effective if the area of contact between the red cells and the serum is large. This is why we use a large bore test tube, and we also mix during incubation. Multiple adsorptions may be necessary to remove an antibody completely. As you saw in the video, we did 2 adsorptions over because we had a strong antibody. Repeat adsorption should use a fresh aliquot of red cells and not red cells from the earlier adsorptions. Enzyme pretreatment of adsorbing red cells can be performed to increase antibody uptake for enzyme-resistant antigens.